Hi, in this video I'd like to talk about the correct way for induced abortions. Now if you watch our videos, we repeatedly talk about the diagnosis and treatment of a recurrent miscarriage, and the most common cause for recurrent miscarriage is induced abortions using the wrong methods. These wrong methods are actually conventional methods that are recommended to all patients who seek induced abortions. So the most common ones is a D&C, dilation and curettage procedure, and the other one is vacuum aspirations. Both of these remove the pregnancy tissue from the mother's body, but the method is very crude, very damaging to the uterine cavity because the scraping is done to make sure there is no pregnancy tissue left inside, to make sure there's no infection that will occur inside the mother's body. So the scraping is done very thoroughly, and this causes a lot of damage unbeknownst to the mother, and then can lead to recurrent miscarriage because when they scrape, they will damage the endometrium, cause a lot of bleeding, cause the formations of adhesions, and worst of all, it will cause the fetal tissues, which means the pregnancy tissue, because they're removing it, these tissues are being shattered, and then when the baby's tissues is shattered, it can enter into the open uterine vein or blood vessels because of the bleeding, enter into the mother's system, and then causing the formation of these antibodies. The formation of these antibodies is what leads to your next pregnancy's potential miscarriage. So later on I will show you a video of a proper way of induced abortions. Nobody is saying that you are not supposed to go for induced abortions, but you must use the correct method. Now, the correct method here, the video here later you can see, is using hysteroscopy. Hysteroscopy is a minimally invasive surgery that uses a hysteroscope, which is an endoscope equipped with camera, which gives the surgeon direct visualization. Unlike normal D&C and vacuum aspiration, the surgeon cannot see what's going on inside. But using a hysteroscope, the surgeon can see directly where the pregnancy tissue is so that they can accurately just remove the pregnancy tissue without causing any damage. It also has a light source, it also has clippers, scalpels, and it is entered via the dilated cervix into the uterine cavity. Take a look at the video and you can see that when the pregnancy tissue is removed, there is almost no damage done because we can easily spot where the pregnancy tissue is. When there is no damage done, there will be no formations of adhesions, there will be no fetal tissue that is entering into the mother's system because the entire pregnancy tissue is not shattered. It is completely and wholly removed from the mother's body. And furthermore, because of how preserved the pregnancy tissue is, we can even do further analysis in the lab to figure out what actually caused it. Enjoy the video.